Hello, my name's Liz Di Nucci and I'm carrying out music psychology research at the University of Melbourne's Faculty of Fine Arts and Music. My principal supervisor is Professor Jane Davidson. My first degree was a BA Honours in Music, followed by a Master's in Education and several years of counselling training. I began teaching in 1981 and have taught a wide range of ages and abilities in piano, keyboard, recorders, singing and trumpet in both the UK and Australia. More recently, I've worked as a pastoral visitor in a retirement homes complex. From this work, I recognise the potential to combine the person-centred approach from my counselling training with a person-centred approach prevalent in one-to-one music education. Both approaches encourage the student or client to become co-learners with a teacher or therapist, taking an active role in the process of therapy and lessons. The teacher's warmth, acceptance, genuineness, unconditional positive regard, and non-directive stance might result in a minimum need for students' defensiveness and shame, allowing self-reflection. The benefits of group musical activities for older adults are well documented. However, one-to-one lessons remain understudied. There is recognition of need for the students to be actively involved in the direction of the lessons. Transformative pedagogy is a person-centered practice prevalent in music education. The student is a co-learner with the teacher, making joint decisions about what music is studied and setting aims for the lessons. Egan's The Skilled Helper model from 1975 is based on a client-centered approach to helping support learners and is embedded in the principle of unconditional positive regard. This project investigates the interactions, learning processes and outcomes of a teacher working with 5 older adult students aged 70 to 80 and 16 one-to-one piano keyboard lessons given fortnightly in their own homes. Specifically, how would the students respond to the combination of musical skill introduction with a person-centered approach that offers psycho-emotional support for the older student? The combination of these two approaches could address the key issues such as loneliness, depression, self-esteem and achievement in the lives of older adults. Person-centered teaching requires that students and teachers work together in collaboration. In Brian's PhD thesis of 2005 on one-to-one student-teacher interactions in piano lessons, she realised the need for student-centered rather than teacher-centered lessons. Coote's PhD thesis in 2016 involved empowering students to take ownership of their learning, which is also known as self-directed learning. This transformative pedagogy was used by Coote in 2019 when she wrote a paper highlighting the teacher's role in facilitating older adults' self-directed learning. My aim is to investigate the person-centered approach to both the relationship between the student, researcher and participants and its use within the one-to-one instrumental lessons. The interpersonal and emotional aspects of this relationship can be the primary mechanism of therapeutic action. The ethics for this study has been approved by University of Melbourne's Ethics Committee, and an independent advocate has been appointed to negate potential bias. Dr. Jackson is a consultant psychiatrist who works exclusively with this demographic and is available to be contacted should any issues occur during the project. Each lesson, the student, researcher and older participants will employ an action research cycle. This consists of a cyclical process of planning what to play, acting on it, observing how it works, and directing the pathway forward for teacher learning. Data will be collected from semi-structured interviews prior and post-study. These will include older student and student researcher reflective journals, a general well-being measurement pre and post-study, together with the occasional audio recordings and transcription of lessons. This data will undergo interpretive phenomenological analysis by the student researcher exploring the emergent themes. Case study 1. Claire is a single lady who lives alone, aged 72. She undergoes 3 sessions of kidney dialysis a week. This treatment is extremely debilitating and curtails much of her social life, adding to her depression. In the initial interview, Claire described her life prior to the study as boring and regimented. Claire also reported feeling she was dumb or stupid growing up as she found school difficult. One of her sons was diagnosed as dyslexic aged 15, and Claire recognized her own difficulties from this. She sometimes has issues with recognizing letters or notes, but is becoming an independent learner, working hard in her lessons and practice. I believe this provides an example of the actualizing tendency from the person-centered theory, where the student progressed from a deficit self-image to becoming more capable and confident in their own ability. In her reflection following lesson 1, Claire said, "I feel more hopeful and enjoyed practicing in between lessons." She is beginning to believe in herself as a musician, becoming more adventurous and forging ahead, learning new tunes a little further on in the book. By lesson 2, Claire asked about how the other participants were progressing. In my subsequent reflection, I noted that this interest in competition could be a legacy from her sporting career, as she played netball and tennis at a high level. This could be helpful for Claire's motivation in learning as well as enriching her life. When lesson 4 came, Claire wasn't feeling well following a particularly taxing week of medical treatment. In light of this, we decided it would be more beneficial for Claire to talk over her concerns with the student researcher and put the keyboard lesson on hold. This allowance provided an example of being client-centered, meeting the client's immediate needs. Case studies 2 and 3 are a retired married Chinese couple in their mid-70s who grew up in Singapore and are English speakers. Keong is a retired surgeon and his wife Wan Ting used to run his doctor's rooms. They have 2 adult daughters who are both proficient pianists, so are aware of some of the issues surrounding learning and playing the piano. Both husband and wife seemed very apprehensive prior to starting these lessons. Keong initially seemed very transactional in his approach to playing the piano. However, by lesson 2, he had sourced a more complex version of Ode to Joy from the internet, which both he and his wife had learned to play. He had also written words to a tune from a Chopin etude and produced a music manuscript. Additionally, he'd bought himself a second-hand electronic keyboard for fun. Wan Ting often likes to sing at the same time as playing her piano pieces, and had also sourced the words for one of them from the internet. She's very excited and can see the potential to use her playing in her work with children. During lesson 5, Keong asked about continuing lessons after the research study was over. He had already been looking at books 2 and 3 within the basic adult piano course we are using. Both Keong and Wan Ting find they are able to fit their piano practice in sporadically during their daily activities. Both husband and wife are having a lot of fun practicing and competing against each other in a jovial manner. I believe this is an example of the actualizing tendency, as they are both realizing building their musical capabilities despite their initial hesitancy. On June the 10th, Keong wrote, "Thank you, Liz, for making us part of your project. I wish you had started your project earlier. I look forward to the lessons each fortnight. Practice times have become part of our lives. Wan Ting and I keep challenging, laughing and encouraging each other. Thanks, Liz. I was apprehensive at first left-right-hand coordination, but with some practice, I think I'm managing it, and enjoying it." He also described this learning as a metaphor for his training in keyhole surgery. The data will be collected from the participants' learning journals, transcriptions of the interviews, and some recordings of the lessons. An interpretive phenomenological analysis will be used to investigate emergent themes in the data. This provides a double hermeneutic where the student researcher tries to make sense of the older adult participants' own reflection of their lived experiences of these lessons. Individual piano or keyboard lessons have the potential to enrich the lives of older adults. The data so far has shown the emerging themes of initial apprehension, followed by relaxation and enjoyment as the participants begin to achieve and build their musical capabilities. The lessons can provide a distraction from health constraints and a supportive relationship to help if other distressing issues arise. This research is debunking the myth of ageism, that older people are not able to learn new things. The following 4 slides are the bibliography, and that's all, folks. Thank you for listening, and are there any questions?